All right. Next is Senator Hernandez. Senator Hernandez has two bills up today. Dr. Hernandez, which you want to start with? Which one would you like to start with?
The nurse practitioner bill.
Okay, so we're going to start with file number 2, SB 323. If the witnesses in support can make their way to the table. And just for everybody's information, the chair is presenting a bill in another committee, so she will be back. I guess depending on how the Senate treats her on her and how she's doing. Senator Hernandez, you may open on your bill. Assemblywoman Eggman.
Thank you very much. Good morning, Mr. Chair and members. SB 323 is a common sense bill that seeks to address the shortage of primary care providers in the state. As we know, due to the Affordable Care Act, an additional 4 million people have entered into California's health care system. The California Health Care Foundation reports that there are approximately 8 million Medi-Cal recipients, 200,000 of them which reside in my district. However, the system that is already struggling to meet the primary cares before the implementation of ACA. So we believe SB 323 would significantly help address the state's primary care provider shortage, especially in areas that are designated as medically underserved areas. For example, in my county, there is only one physician for every 1,649 residents. That is well below the state average, but indicative, I think, of a lot of areas of low socioeconomic backgrounds. Decreasing the ratio of residents per primary care providers can ensure that patients with preventable and or controllable chronic diseases such as asthma, heart disease, and diabetes receive the primary care they need. And I would add, especially in areas that are already underserved and have a higher incidence of these kinds of chronic illnesses just due to issues around poverty and lack of access, as well as air quality and access to fresh fruits and vegetables. Unfortunately, California is the only state in the western United States, along with Utah, that does not allow nurse practitioners to work within the full extent of their training and without physician supervision. In fact, nationwide, California is only one of 13 states that place this level of restrictions on nurse practitioners. This group includes Texas. The Institute of Medicine points out that there are no studies that suggest nurse practitioners are less able than physicians to deliver care that is safe, effective, and efficient. SB 323 will go a long way to ensure the primary needs of Californians addressed by a highly qualified nurse practitioner, again, especially in areas that have high poverty and are already medically underserved. Respectfully ask for your aye vote when we get there.
Thank you, Madam Chair and members. First of all, let me take this opportunity to thank Assemblymember Eggman for not only presenting, but also for being supportive of the measure. This is not new to you. It's come before you in front of your hearing before. It's new, obviously, to some of the new members. But very briefly, let me kind of talk about how I came about this body of work. 2006, when I got elected to the Assembly, and shortly after that started serving in 2007, I was given a select committee on workforce. And this is pre-Affordable Care Act. And even then, we had a significant problem, especially in the rural and the inner city in primary care. With that body of work, we looked at all ways of how we're going to increase that workforce. And in this committee, you passed out, Governor signed into law SB, the bill dealing with the pharmacists, which is now becoming a national model, and more pharmacists are participating in the primary care with the patients in the state of California. And I believe that this profession can make a profound impact as well. So we can no longer afford to get by on a fraction of our professional capacity. California needs more healthcare providers practicing to the full extent of training so we can all have access to a system efficiently. This bill is a simple and modest policy that is long overdue here in the state of California. It does three things. Number one, it establishes a uniform scope of practice for nurse practitioners that is widely agreed to be the services that NPs perform today safely. It explicitly requires NPs to refer a patient to a physician or another licensed care provider if a situation or condition presents that is beyond the NP's education or training. It grants nurse practitioners the ability to practice outside a physician-directed standardized procedure if the NP is certified by a national certifying body, maintains professional liability insurance, and is practicing in one of the following settings: a clinic, health facility, or county medical facility, an accountable care organization, or a group practice. You will hear from the opponents today. They say the bill will put patients in jeopardy. The reality is there is over 50 years of evidence in the 20 states that already allow full practice authority that all say the same thing. When consumers are treated by nurse practitioners, patient outcomes are equal to their physician counterparts, and patient satisfaction is generally better. Opponents will likely offer anecdotes and personal stories to make their point about safety. However, if this policy puts puts patients in harm, we would see much more evidence in other states. But there is no evidence of that. They don't have any data to back up that particular argument. You will hear from opponents today that granting nurse practitioners full practice authority goes against team-based coordinated care and further fragment the healthcare system. Nothing could be further from the truth. Healthcare is transitioning to a team-based approach in managed care, and we're evolving more and more, and this bill will do nothing to change that. We have crafted this bill to ensure that NPs with full practice authority are practicing only in team-based settings. That is one of the reasons that CAPG, these are physician groups, the largest physician groups in the state of California, who are the leaders in advancing coordinated care in our healthcare system, are strong supporters of the bill. These are physicians. They would never support something that moves healthcare towards a fragmentation. You will hear from opponents that NPs order more tests and can be more expensive than the physician counterpart. If that's true, the health plans won't contract with them, and medical groups won't hire them. In a world where 3/4 of the care in California is delivered in a capitated system, and over 80% or so is in managed care and Medi-Cal, there isn't much tolerance for waste, and especially with the consumer making sure that there's cost controls. Finally, you will hear much debate today about whether we should expand the ban of corporate practice of medicine to nurse practitioners. And since the corporate practice ban is established in the early 1900s, its usefulness has waned significantly and healthcare delivery has evolved. Some have argued that it has even become a barrier to innovation. As it stands today, more states have abandoned the exclusion of corporation ban of medicine. Right now, there are only 5 states prohibiting hospital employment of physicians. The Federal Trade Commission has said that the ban is anti-competitive and has the effect of restraining competition. Even the American Medical Association has removed the ban from its principles of ethics. In fact, I'd like to quote directly from the AMA on this topic. Physicians should be free to choose whom they to serve, with whom to associate, and the environment in which to practice medical care. With all due respect, I would really admire the professional and what the chair's wishes are, but I do know that we choose to extend this obligation, that we do not choose to extend this obligation policy. Please join us along with hospitals, clinics, health plans, physician groups, large and small businesses, labor, consumers, academic groups, large and small business, and seniors, and an array of healthcare providers in support of this measure approach to full practice authority for nurse practitioners. And with that, members, I respectfully ask for an aye vote, and I have witnesses that would like to speak in support of the measure.
Thank you. Witnesses in support.
Good morning, Madam Chair and members. Christy Weiss on behalf of the California Association for Nurse Practitioners. We have 2 NPs here who are going to speak to you about their education and training and their direct experience. But just 2 points I wanted to make as we go into this discussion. You all have lots of conversations around Medi-Cal. What can we do to fix Medi-Cal, to improve access to Medi-Cal? California now has a historic number of enrollees with the expansion under the ACA. And I think one thing that's important to keep in mind here is that currently a nurse practitioner cannot see Medi-Cal patients unless his or her supervising physician has chose to see Medi-Cal patients. And as you know, the physicians are very concerned about the rates. Should this bill be enacted, we would have a whole new pool of Medi-Cal providers who would be ready to jump in and help serve that population, which we think is an important note. Second, you're going to hear from the opponents that this bill makes nurse practitioners be the same as physicians. We have a fundamental disagreement with that. Physicians, like lawyers, when they get a license, they can practice They can do everything and anything. That is not the case for nurse practitioners. They have a limited scope of practice, they get a much more limited license, and this bill would not change that. So with that, I'd like to introduce Deborah Bakurjian, who's here from UC Davis, and Sarani Kwan, who's here from the Russian River Health Clinic.
Thank you, Christy. Good morning, Madam Chair and members of the committee. My name is Deb Bakurjian. I'm the Senior Director of the Family Nurse Practitioner and Physician Assistant Program at UC Davis. I've been a nurse practitioner for 25 years. I would like to speak this morning about the nurse practitioners from the perspective of how the educational process prepares NPs for practice. As some of you may know, NPs came into being in response to physicians leaving primary care and entering specialty practice more than 50 years ago. That situation has not changed much over these 50 years. At first, NPs were directly trained by physicians. Then the first NP program was developed in 1965 by Loretta Ford, a nurse, and Henry Silver, a physician. From the beginning, NPs have had a collaborative relationship with physicians. There was a lot of controversy initially about the role from both nurses and physicians. But as more nurses were educated, more physicians began working with NPs, and more patients were exposed, attitudes began to change. At the same time, NP education programs were expanded to provide more formal education for this role. Researchers began to examine the role, and the next 30 years saw a number of studies initiated to evaluate this new role. 2 studies were published in medical journals, the New England Journal of Medicine and the Journal of the American Medical Association, both very high-impact medical journals. Those studies supported that there was no difference in quality outcomes between NPs and physicians. Subsequently, there have been a number of studies that have been published in a variety of settings that have supported those same findings. So let's talk about what it takes for an NP student to be ready for the practice environment. NP programs build upon the 4 years bachelor's degree and an RN license. On average, NP students have 7 years experience in nursing, or about 15,000 hours. When they enter an NP program, so there are 22 NP programs in California that are approved by the Board of Registered Nursing. 9 are private schools, 9 in the CSU system, and 4 are in the UC system. NP programs must meet the standards of both the California Board of Registered Nursing and the National Accrediting Agency for Nursing. Program lengths vary, but most are 24 months long, with a range of 18 to 36 months. Those longer programs stemming from the doctorate of nursing practice and the master's entry program of nursing. The accrediting agency requires that all programs include an academic core, which really focuses on research, health policy, and financing, including understanding managed care, ethics, human diversity, health promotion, and disease prevention. The Advanced Practice Nursing Core focuses on physical assessment, physiology, pathophysiology, and pharmacology. Then the specialty curriculum content really focuses on whether that advanced practice nurse will be a nurse practitioner in primary care or a nurse practitioner in acute care. In addition to the didactic and clinical simulation portions of the program, NPs must complete at least 540 hours of supervised clinical practice in California. The national average is actually 720 hours, and our program at UC Davis requires 760 hours, although most NPs actually have supervised clinical practice that's closer to 800, 900, or even 1,000 hours. NP programs consistently train NPs to be prepared to be part of an interdisciplinary team. At UC Davis, our leadership course has a focused section on interprofessional education competencies as outlined by the Institute of Medicine report. Students have opportunities to learn physical exams side by side with medical students and medication management alongside pharmacy learners. Once finished, NPs finish their educational programs, they are eligible to sit for a national certification exam and can be licensed as an NP as soon as the state receives verification that they have completed and graduated from a BRN certified program. There is certainly a difference in education when compared with physicians. Medical education is focused deeply on basic sciences such as pathophysiology and disease management from the routine to rare diseases and includes both surgery and medicine. NP education has a far more focused, a greater focus on disease prevention, health promotion, quality improvement, patient safety, and care coordination. Disease management focuses on more common diseases and recognition of emergency issues so that early referral can be initiated.
You need to wrap up if other people are planning to testify.
So certainly we recognize that there is some bit of crossover into what many refer to as medical practice. But the reality is in California we have more patients with health care coverage who need care, and there are fewer physicians who are in primary care. So NPs are needed to provide access to those who need this care. So we believe that NPs will continue to manage these common primary care problems without the burdensome and unnecessary administrative oversight with the existing regulation. I strongly urge you to urge an aye vote on SB 323. It will improve access to high quality and safe primary care for patients. Thank you.
Next witness in support.
Good afternoon, Assemblymember Bonilla and members of the committee. Apologize for my back to you all behind me. My name is Sarani Hair-Kwan, and I'm a nurse practitioner at the Russian River Health Center in Guerneville, about 20 miles west of Santa Rosa. My clinic is part of a group of private, nonprofit, federally qualified health centers in West Sonoma County. More than 40% of our patients are living at or below the federal poverty level, and we have more than 300 homeless people living in our service area, often getting homeless from other parts of the county. Our clinics deliver health care to an important cross-section of our community, including children whose parents cannot afford medical care needed to keep them healthy and active in school, those who are not accepted elsewhere due to their HIV/AIDS status, homelessness, mental illness, or addiction, and those in the community who lack financial resources to pay for quality health care. No patient is turned away from our clinics for lack of funds. In 2012, our groups of clinics provided over $1 million of uncompensated care for low-income and uninsured patients. We offer a full scope of primary medical and dental care as well as mental health services, and our HIV/AIDS primary care program was one of the original grantees for the Ryan White Title III funds. Our clinics are staffed with highly qualified healthcare teams, including physicians, family nurse practitioners, and physician assistants, as well as dentists, psychotherapists, nurses, and support staff. The entire healthcare team works together to take care of patients, and we collaborate with each other when there is a question about a symptom or a need for resources. I've been at this particular clinic for 15 years and have worked solo for some of those shifts. We all have. Sometimes we don't have enough providers to take care of all the patients that need to be seen. Nurse practitioners are a way to improve access for patients who need care. Nurse practitioners also provide cost-effective care because we're not paid as much as physicians. My care is as good as my physician colleagues, and they would agree with that. But I've experienced barriers in my ability to care for my patients because of current standardized procedure model. I'm going to give you an example of what happened just last month in my clinic with a longtime patient of mine. He'd come in to see me with a swollen elbow. He has a long history of drug abuse, alcohol abuse. He's a major weightlifter. He's very clean. He's been clean for many years. So after catching up with him and talking to him about some health care issues that he needs to follow up on, I determined that he had bursitis from all the weightlifting that he's been doing because he's entering a competition again. I've been trained to diagnose and treat bursitis. I've even assisted my physician colleagues in several of these procedures to drain bursitis over all these years of work. But because of the requirement that I have a standardized procedure that specifies what I can treat and how I can treat any medical procedure, unfortunately, I could not care for my patient with the right procedure at the right time. So what happened to him? My patient didn't have the money to return to the clinic to see one of the other physicians, so he showed up at the emergency department at a significant cost to his insurance company, which happened to be Partnership. So will Senate Bill 323 change patient care and what I do? No. Nurse practitioners will continue to care for the types of patients that we've been trained to care for. What Senate Bill 323 changes is the delivery of health care. Patients will have improved access to care. The passage of Senate Bill 323 offers me and nurse practitioners like me the ability to deliver care to patients without the administrative barriers to that delivery of care that is both efficient and cost-effective. I urge you to vote yes on Senate Bill 323 to create a clearly defined scope of practice for nurse practitioners in the state of California that allows us to diagnose and treat our patients as we have been trained to do. Thank you.
Thank you very much. In support.
Hi, Madam Chair, members. My name is Ann Coons. I'm the president and CEO of the California Children's Hospital Association. I'm here today in support of SB 323. The California Children's Hospital Association represents the 8 not-for-profit freestanding children's hospitals in the state of California. We train over half of the pediatric residents in the state. We represent more than 40% of all pediatric licensed beds in the state. And we saw 107,000 inpatient visits last year and 1.8 million outpatient visits in our hospitals. We use nurse practitioners throughout our 8 hospitals. We have hundreds of them employed. They serve in every capacity in our hospitals. They help train residents. They work in the NICU with neonatologists. They support our mobile clinics, our mobile vans. They work in our outpatient clinics. They're navigators for our medically complex patients, and they help and treat our hematology and oncology pediatric patients. We very much support the work that they do, and given in light of the pressure from the Affordable Care Act, as well as the state of California and Medi-Cal to try to better integrate care. As you know, the legislature just recently approved funding to create medical homes for complex patients. We're all under a lot of pressure to make sure that we are really approaching things from a team-based, and we're using all of our healthcare resources as effectively and efficiently as we can. We have an ongoing issue with the ability, particularly in some of our hospitals, to ensure that we have appropriate staffing of pediatric subspecialists. It's very hard to find people. A pediatric neurosurgeon, for example, on call 24 hours in some areas of the state. So to the extent that we can use nurse practitioners effectively, we want to make sure that we use everyone effectively so that we can really use those specialists when we need to. I know that one of the items that's come up with respect to this bill has been whether or not to extend the corporate ban to nurse practitioners as part of this bill, and we would not be supportive of that proposed amendment. For one thing, it is, as I mentioned, with respect to pediatric subspecialists, it's very complicated when we're not able to employ physicians directly to make sure that we can have call and have adequate coverage. It adds a layer of complexity. It adds a layer of cost, something that we really don't think in this era of making sure that we're trying to keep costs down we can really afford. And it would impair our ability to respond to community needs effectively as we find more needs to be out in the community to make sure that we have outpatient services effectively and that we're really able to respond to needs as they come up. That's a real concern to us. And finally, it really would impede integration. As we move towards this idea of medical homes for complex patients, many of our patients have significant degree of medical complexity. Making sure that we can really approach things from a team approach and make sure that we can be fully integrated. This adding that corporate ban for nurse practitioners would really go in the opposite direction, so we would not support that. Thank you.
Good.
Good morning, Madam Chair. Bill Barcelona, California Association of Physician Groups. Our organization occupies kind of the middle ground in the delivery system. We are payers and providers. Our physician groups are made up of physician-owned and controlled entities that are licensed as professional medical corporations in California. We now have members who operate in 38 states across the United States and serve over 20 million Americans. What we've seen from our experience with non-California CAPG member physician groups who've included autonomous practice nurse practitioners is that there's been an expansion of access and a flexibility in the way their practice models can be designed to deliver greater access and higher quality care. So that's why we support this bill, because experience has proven that this type of change in the law does facilitate higher quality care and better access to care. Here in California, what we've experienced over the past 3 years is a doubling of the number of lives that are covered in our Medi-Cal managed care groups. We've gone from 3 million lives to over 7 million lives. We have a decreasing number of primary care physicians to service that population. We need to come up with more flexible, more adaptive, and more cost-conscious delivery system models to address this increasing population in California. One way to do this is to create this type of licensure for nurse practitioners in concert with some of the other bills that Senator Hernandez has carried, including advanced practice pharmacists. So that's why we support this bill, and I'm happy to answer any questions that the panel may have this morning.
Thank you. Others in support, name and organization only.
Pat Whalen, Ellison Wilson Advocacy here on behalf of United Nurses Association of California, Union of Healthcare Professionals, very much in support of the bill in chief. We would, however, have to switch our position to oppose if the amendment regarding the corporate practice of medicine was inserted. It would be counterproductive. It would actually be a step backward from current law.
David Ford on behalf of the Alliance of Catholic Healthcare and the Private Essential Access Community Hospitals in support of the bill. Like the previous speaker, we would have to reconsider if the corporate practice ban were inserted. Thank you.
Alexandria Felton with the Silicon Valley Leadership Group in support, and as the previous speaker noted, we would have to change our position if the corporate practice ban was inserted.
Les Shepard representing Stanford Healthcare in support, and ditto with the previous speakers.
Alex Hawthorne on behalf of the California Association of Nurse Anesthetists in support.
Cornelius Burke with the Bay Area Council in support.
Dr. Jenny Mann, naturopathic doctor, in support of this bill.
Hi, good afternoon. Blanca Castro with AARP, and on behalf of 3.2 million consumers and voters, I support.
Good morning, Elizabeth Espinosa on behalf of the Association of California Health Care Districts, also in support with the same caveat you heard from previous speakers. Thank you.
Hi, I'm Jeannie Brown. I'm an RN, and I'm here to represent my husband, Daryl Brown, who is a nurse practitioner. He has 15 years of experience. He's master's prepared and has worked in family medicine and is a U.S. Navy commander veteran retired. We live in Rio Vista, which is a small town of 8,000 in District 11 in the Delta region of Northern California. There are no MD services in our town available. And if this bill passes, we will be able to open a clinic in Rio Vista and be able to serve the people who really need it. And
thank you.
Thank you.
Pat McFarland from the Association of California Nurse Leaders, the California Student Nursing Association, and the California Association for Colleges of Nursing. We're in support of the bill.
Luis Sanchez, Blue Shield of California, in strong support.
Thank you.
Brian Warren with the California Pharmacists Association in support.
Garrett Chen from the California Association of Clinical Nurse Specialists in support.
Thanks.
Angela Gilliard with the University of California, and as you are likely aware, the University of California has the largest health sciences program in the nation. We have 17 health professional schools, 5 academic medical centers with 11 hospitals, and we're in support.
Thanks.
Barbara Glazer with the California Hospital Association and the California Association of Public Hospitals in full support of the bill as is. If the bill were to be amended, as suggested in the analysis, that would change our position to an oppose.
Chair and members, Sean South on behalf of the California Primary Care Association in support.